Well, what I was really looking for in a CRM is something that would make us more efficient in general. Just backing up a minute, when I came aboard, things were very disorganized in terms of how accounts were accounted for. The liaisons were not attached to their actual referral sources in any systematic or organizational way. They pretty much, some people had them on paper, a list of their accounts. Some people had them on Excel spreadsheets, the one that were a little bit more technical. So first and foremost, I was looking for a program where I could tie my referral sources, or tie my liaisons to their referral sources, number one, and have a way I can track and trend my referrals from different referral sources. So those were the primary things that I was looking for. But then, I uncovered so much more as part of this, as I was digging in and the data started coming over, starting to look at pendings and non-admits and reasons why things weren't being non-admitted, a reason why things were pending for so long. And it really helped us clean up our system as well. So it led to many other kind of things that I was not even intending for it to help. But it was really, year to date, we have increased our referrals by 2,000 over prior year. It's been a challenge in this industry where there's more managed care, less Medicare, to really manage our costs. And in order to manage your costs, you got to be efficient. You have to know where your business is coming from. You have to know, if you're out, my liaisons are out during the day, that they know what's coming in, what's some of the problems or issues that might be with a particular referral that they can possibly help with. So, it has given them the ability to really have knowledge of a referral out from the field, which they don't have to come to the office anymore. They don't have to spend hours every morning, look about what happened previous day. They don't have to call and bug intake or clinical operations about statuses of patients of, did you receive this referral? Are we seeing this patient tomorrow? It's really helped assist the clinical staff, the clinical ops staff, reduce the amount of phone calls that went into them, which has in turn made that department more efficient. So overall, it's just in terms of managing the liaisons, tying them to their accounts, giving them the information and tools necessary in the field, it's been great. Well, I liked the fact that it was kind of a web-based portal. My intent was to get my liaisons iPads. I just didn't know what CRM system I wanted to use. I actually initially, it was from McKesson, who we use as our EMR system. I got PlayMaker's name through them, and reached out to PlayMaker. And as I was learning about the integration, how easy it would be, that there was already experience and knowledge on the technical side from your team, that they had already known how to deal with McKesson. They can pull the data, no problem. The integration will be easy. Those type of things were very, very, in the end, deciding factors, as well as being able to just work from the field. So, okay, the program does work from an iPad. It is web-based. You can get it from anywhere. You can get it from your hospital that you're at. You can get it from a skilled nursing facility that you're at. You can get it anywhere. And as long as we provided the hardware that made that capable, that you guys were able to, as a CRM system, deliver that. I just want to say, thank you to the PlayMaker team. Along every step of the way, they've been very helpful, been very patient. John, when you came out, we had some users who never even used an iPhone or iPad before, and yet now they're getting iPads and getting a CRM system. So, you were very patient in the training, and I really appreciate that. That was something that I think that the comments that I had heard after the training were very positive, and the ability for them to call customer service and get help at any time. Of course, I'm always there to help them from an account management standpoint, but the patience and the customer service that you guys have provided and your team has provided has been outstanding. And for someone who's just using the program for the first time, that's big, because we have tons of questions. So we just want to say appreciate the PlayMaker staff.